Welcome to In Support of Families. This is Emmylou Penrod, and my guest today is Geoff Cly, a board-certified OBGYN with 20 years experience. He's delivered over 3,000 babies and seen over 100,000 patients. Geoff, welcome.
Thank you very much for having me on, Emmylou.
And I've seen by your website and also heard from you that you are calling yourself the honest OBGYN.
Right.
That is
Sure.
so intriguing. Go ahead.
Yeah, thank you. It's funny. So I launched the website honestobgyn.com, and part of the development was that, and I worked with someone who helped me with the branding. He said, Geoff, you are the honest OBGYN. And it never started that way, but I was like, yeah, okay, that's what I'm trying to do, is be honest as an OBGYN. And it does help try to get the message across. And what my uncle said recently, he's like, Geoff, if you're the honest OBGYN, that implies that there's people who aren't being honest. And I said, Uncle Jim, you're right. And after doing this for 20 years, what I'm trying to do is speak out to the patients, women and their families, so that they can avoid unnecessary surgeries and outdated procedures, because there are some docs who haven't kept up to date. And so when I say honest, that's part of it, is making sure that you're offering your patients the right treatment that's up to date and not outdated, like big incisions, 3-day hospital stays, where the same patient could go home the same night, drive the next day with almost no pain, and teeny-weeny incisions. And so that's kind of where it came from.
Well, I know the medical field has changed so much. When I was born, my mother stayed in the hospital for 10 days.
Right.
And when I had my first child, it was 3 days. And now I understand it's down to just a day, right?
Yeah. And that there is a happy medium. I do have patients who have had babies and like to go home in less than 12 hours. And first time moms, I think 48 hours is probably a bit better, but 24 is pretty customary to go home after having a baby. Yeah. And in the past, the good old days, they call it, you used to go into the hospital and that's where they would do the evaluation for your surgery. And then your surgery would be a day or so later. And now, as everything's changed, everything is converting to, you go in, you have the procedure, go home. And in most cases, you can drive the next day with little restrictions. So it's pretty wild. It's almost like Star Trek nowadays.
It is amazing. And you made a comment when you described yourself as the honest OBGYN about giving the full story. Yeah. And that really resonated with me. And I think that's what's missing in healthcare now, especially in women's health, is we're not getting the full story, maybe not knowing all of the options.
Right. I totally agree. And after doing this for 20 years and feeling the rush nature of how it's done now with the computers and the system and the insurance, it has definitely changed, and not changed for the better. And so when I'm seeing patients, it's very difficult to tell them all of their options. And when I do that, it makes me later. And so then I have people who are waiting longer. And so that's part of why I wanted to get it out to the internet and out to the world, so that women can look up the treatment options for their diagnosis, because they've heard frequently what is the problem from their doctor. And that way they can verify on the internet that they've heard all of the options, or educate themselves about the options, so that when they go in, they can say, you know what, doctor, I really want to keep my uterus. I'd like to hear about these 3 non-surgical options that would save my uterus. And it also helps the doctor to know where the patient's coming from and what their goals are. And so that's my mission, is to try and educate women on their OBGYN treatment options, so that they know what's best for them and they can make an informed decision.
Well, that reminds me of the title of your upcoming book, Wait, Don't Take My Uterus. I love that, because I remember that time. I'm old enough to remember that time where it was almost just
Right.
like decades earlier, tonsils were automatically removed. And then I remember
Mhm.
it would seem to be commonplace for older women. It was just kind of like part of aging.
Right. And everything's changed. And so I put that in there because it sends that signal and message to people. Hold on a second, wait a second. Because I find that a lot of women come to me for hysterectomy, and I do a lot. I've done thousands of surgeries. And most of the time I say, hold on a second, before we jump into the hysterectomy, is there something else we could do where we could solve the problems without taking out your uterus and doing a big surgery? And vice versa, there's a lot of women who don't want a hysterectomy, but they don't realize that there are other options. And unfortunately, it still is predicated on what your doctor does. And so if you go to your doctor and they only do hysterectomies and they don't do the non-surgical or the newer procedures, you won't know about those other procedures. And the system still allows for that to happen. And that's why I one of the other reasons is the medical system says that what your doctor determines is best for you is acceptable, even if it's an old, outdated procedure, because that's what your doctor does. And to me, with the age of the internet and the iPhones and the droids and the information that's out there, I think that it's not fair to patients that they aren't informed about their different options. And a quick story about this, it happened about 3 years ago now, where I've been doing robotic hysterectomies since 2005. So my patients go home the same day or next day with very little pain. And I was doing a surgery in room 2, and my partner, who was doing a surgery room 1, and that partner told me, he goes, Geoff, I got 10 years until I retire. I'm not going to learn how to do the new stuff. I don't want to learn the Da Vinci, and I'm going to do it the old way. And so I didn't know he was doing the old way next door to me. And so I was covering the patients for the weekend and seeing the patients on call. And I went into this lady's room, and she had this large incision. And because I had to cover her, I had to look in her chart and found out that he had flat out lied to her and told her she was not a candidate for the new Da Vinci robotic surgery that 8 of our partners do. So he was one of 2 guys who chose not to do it, and 8 of us did. And he lied to her, and so she had a lot of pain, was in the hospital for 2 days, couldn't drive for 2 weeks, and couldn't go back to work for 6 weeks. And to me, that was wrong. And so that hit me in the core and said, this isn't right. That even though most docs are doing the right thing, there's still a few holdouts. And if I can't change their behavior, I can educate the patients so they will know the red flags, and they'll be able to say, wait, don't take my uterus out. I don't want it done that way, or I want something different.
You know, years ago, there was the big emphasis, always get a second opinion before you undergo any surgery. But as you pointed out, now with the resources available on the internet and through sources like your book, we can learn more of our options. And you know, you're right. I have to admit that thinking of, well, I'm going to be retiring soon. You know, I was a school teacher for a couple decades, and I met teachers like that too. So, you know, there is that mindset, you know, people don't want to change, but you know, you have a good doctor, a good professional, when they're willing to learn from new technology. And you were describing the robotics. Does not require a large incision.
Right. It's amazing. So just small incisions about the size of a dime, 3 to 5 small incisions, and with very little pain, that you can do most surgeries through. And it's in most surgical fields now, which is really cool. And that's kind of the newer method that's been around now for 15 years. And so that's also something I do, is I teach doctors how to do that. And I told my former partner, I said, without saying his name, I said, look, you could be trained in 3 days. I mean, they want to train doctors how to do this. But he's in that old mindset. And so on the website, honestobgyn.com, that I developed, So I make available pathways. I call them pocket guides, and then videos about hysterectomy and bleeding, endometriosis, so that that will be in the book that's coming out here in the fall. But also that way women can get that information now by going to that site and get it 24/7. So if they've just were told they need a hysterectomy, for example, they could go to the website and I'll give them the guide, the pathway, and the guides. It's available for purchase at an extremely low price because we want to get the information out. Right now, it's only $37, about the price of copay, because it's so valuable for women. And they'll know tonight whether or not their doctor's on the right track. And if their doctor's telling them they have to be cut open or they want another option, they can say, it's in the language there. They can hand this download to their doctor and say, tell me about this option, because I don't want this big surgery you're talking about. And there's even I've also made available physician directory so they can search by zip code if they need a new doctor. If their doctor's resistant to the new technology or the new ideas, then I've made available a zip code search, and they can find an OBGYN in their area who's doing the new information.
That is so valuable. And, you know, even as you were talking about the robotic hysterectomy, I had never heard of it. And I'm wondering how many women are totally unaware of what is available. I love that you're doing this service. Now, I've also heard that you are an expert on miscarriage. I know this is a heartache for a lot of women when they suffer a miscarriage. That's losing a child.
Oh yeah, it's tragic. It's absolutely tragic. So I help prevent miscarriages and prevent stillbirths. And over the last 20 years, I've got a name for that and known for that. And so it is a wonderful thing when a woman, it's not wonderful that she's had miscarriages before, but a lot of times women come to me and they've heard about me and they say, I've had 4 miscarriages. My doctor said I might as well adopt. I'll never be able to have a baby. But doctors don't like this area. They don't do the workup. They don't look into it. And so I just say, you know what, let's evaluate you. Let's do some tests and let's find out the problem. And in the 90% of the time, we can identify a problem and fix it with some medicine and some vitamins and get them through the next pregnancy, and they take home a beautiful baby. And that joy is amazing. And to see women get hope back is fantastic. And so that's become a passion of mine, just to be able to do that. And I went into this a long time ago, and it came out of a traumatic experience that a young woman who was pregnant came in, and I followed her during the pregnancy. And she came in, she didn't feel her baby move. So I said, come on in and we'll listen to the heartbeat. But when she came in the office and I tried to listen to the heartbeat, there was no heartbeat. And her baby had died inside of her at a stillbirth, just a few weeks away from delivery.
Oh,
and it was awful. The trauma she went through was horrible. And as an OBGYN, that's something that is one of the worst things we do, is have to tell a mom that their baby's not alive anymore. And this is about 15 years ago, 16 years ago now, when there was not as much information. And we were told as doctors, oh, it just happens sometimes. Just reassure them it probably won't happen again the next time. And I said to myself, this is crazy. How can a God create the system where a mom can grow a human inside of her, and so many things go on and normally to develop, and then this beautiful baby comes out. But sometimes the creator would say, oh, it's just an accident. It's a coincidence. That baby's not going to live. And I said, that's not right. Doesn't make sense to me. And so I started looking around along with other OBGYNs, and I didn't do the research, but I found the research, and other smarter people than me said, here's the things that are causing the issues, and here's how to fix them. And so I've just used the knowledge that I've learned over the last 15, 16 years, and it works, and it's easy. But docs don't like grief and death, and they try to just stay away from that. And
Mhm.
so I've found that it's been a passion of mine to help moms. And so I'm able to help them prevent a stillbirth. And we look for problems before they happen. And we find the things for miscarriage prevention in the beginning. And, like one little tip that all your listeners could know is if a woman has a family history of miscarriages or stillbirths in any of her female relatives, there is a good chance that she has inherited an enzyme deficiency that we can fix with baby aspirin and some special vitamins that will prevent a miscarriage. So the family history is one tip that to tell women if your mom or your aunt, grandmother had miscarriages, that will qualify them to get some blood tests done covered by their insurance to investigate it. And so some little things like that can make all the difference in the world.
That is a valuable tip. Plus, the first one you gave of checking, when your doctor recommends a surgery, how you
Yeah.
can check and find out, are there
Yeah.
options? Just knowing that you can get information on the
Yes.
options that are available for you.
Yeah.
Okay, now so your practice is in Indiana, correct?
Correct.
So anyone there can get personal one-on-one in-person help. But I love how you are now opening this up, your information, your knowledge, your experience. You're now opening that up through your website and through your book.
Yeah, thank you. Yeah, so anybody can come and see me. I'm actually transitioning to a new practice that I'll be opening in October 14th. And so they can, if they follow me on the Facebook or on the website, then I'll be posting that phone number and information as soon as it becomes available. Right now, they can talk to me online. So I have a private Facebook group for members for that really low price, where they can post questions 24/7. I do live talks and interviews like this every week and different topics every week. And those are all available just to get that information out to them, as well as the downloads and the videos. And then they can even talk to me as a coach, a health coach right now. And then the next avenue, which I'm excited about, is telemedicine. And there's some regulations. So the next step will be where I'll be able to actually prescribe medicine over state lines and actually be an online doctor for some of the things like recurrent miscarriage. We don't necessarily always need to do an exam in the beginning. We got to get you on some medications and some vitamins in the beginning to protect the baby. So that's in the works. There's a lot of red tape with that, but that's in the works so that I can try to help from anyone from anywhere and until they get plugged in with a good doctor in their location.
So, okay, just to make sure I've got this. So you, starting October 14th, will be offering like online question and answers. This is a service they can sign up for where they get information directly for you. Is it like a subscription or as needed?
Yes.
Or?
Yeah, so that online is right now. They can get that right now through honestobgyn.com. They
Okay.
click under the video. There's a video I have that I had created a couple of years ago, and they click under there, and they'll take them to where all that information. So they can access me and talk to me right now online. But if they want me to do their surgery or deliver their baby in the office here in Indiana, that's what the office practice will open October 14th.
Okay, that's the office practice. And then you're in the process of finding how you could be an online doctor in terms of prescribing medication.
Right.
What?
Yes.
That's wonderful.
Yeah, thank you. That takes a little time because of all the different laws in each
Oh,
state.
yes.
But yeah, so I can't prescribe medicine out in California right now because of all that. But that's what we're working on, so that someone could say, "Hey, I'm in Alaska. I need some medicine. I'm pregnant right now. What do I do?" And I could help them until they get plugged into their doctor.
Yeah. With the internet has made so much possible. It's really exciting. But I love that you're not, you know, and if you live in a rural area and there's just one local doctor, you do have
Yeah,
options. And I agree with you that our
absolutely.
bodies were designed to heal and to
Hmm.
produce young, and
Yeah, yes,
we just need to know how to. I love that approach of working with your body, and
absolutely.
it's awesome.
Yeah, yeah, it's so true. It's so true. The healthier we can get, and the better people feel. And so what you're saying is our bodies were created to do amazing things, and we just got to help it along and putting in the right requirements, right vitamins, minerals, things we eat and drink. It makes all the difference.
Yes, it does. All right. So the best way for people to contact you would be through your website, honest
Yeah,
obgyn.com.
honestobgyn.com. Yeah.
And there's a slash between the OB, yeah, right? GYN. Okay.
Oh yeah. Oh no. Yeah, no slash actually.
No
It's
slash.
just yeah, just
Oh,
honest and obgyn.com.
there we go. All right, right there. And then you do have a Facebook page. Is that also the
Yes.
Honest OBGYN? On
Yes.
Facebook.
Yes.
So they can find you on Facebook. They can go to your website. They can get information. And then your book will be available on
It looks probably, yeah, it'd be available on Amazon. It probably is going to be published right around November, is when it'll be coming out, and we'll put that information on the Facebook page, and we'll be including that in the online offer as well, just to get the word out to people so they have all the information they need.
and and it's such valuable information.
Thank you.
I am so glad you're doing this, Geoff, and thank you for your
Thank you.
time, and I appreciate it. I know how busy you are, so thank you so much for your time and sharing what you're doing. And you
Awesome.
have a great day.
Thank you, Emmylou, and thank you for what you're doing. It's wonderful meeting you in person at the conference, and I really appreciate it.
All right.